while a proximity app would assist in identifying casual contacts, many people were concerned about a centralised model that it would harvest their data. In the trial, this one failed to detect 96% of contacts. So why did he persist so long with an app that simply didn't work on the majority of phones?
Thanks, Mr. Speaker. I'm afraid the Honourable Lady is wrong. The trials in the Isle of Wight showed that the app worked on Android phones but was blocked from working effectively on Apple phones, and hence we're now working with Apple and Google, as we have been over the past few weeks, to find a system that can be effective. But I will not sign off on an app where we don't know and haven't been told by some multinational company what it is recommending to people, because after all, what matters is the critical thing that matters in test and trace is that people isolate to break the chain of transmission.
Dr. Philippa Whitford.
I would gently suggest that iPhones are actually quite common, so it's important that it does work on iPhones. The boss of Serco has admitted that their contact tracing system will not be fully functioning until the autumn, and we find that actually local public health teams are carrying out the vast majority of contact tracing. So would government money not be better spent reversing 5 years of budget cuts to public health?
Mr. Speaker, it's very strange taking these questions from the SNP spokesman, given that I'm working with the SNP government on resolving exactly these problems in Scotland, and maybe the SNP would do better to focus there. In response to the second question, honestly, we've put in £300 million of support into local public health, directed public health, in order to tackle this pandemic, and I know that her colleagues in the Scottish Government are working hard with local authorities in Scotland as well in exactly the same way.